Hi everybody. This is Amit Singh from Techplus Media, and I would like to heartily welcome Mr. Santhosh K, who is the Group Head IT of Jehangir Hospital, in this very interesting interaction that we are having today. Okay, so Mr. Santhosh, I just want to understand, first of all, I want to understand you've got an extensive experience in the healthcare sector. Okay, so what are the unique changes that you have seen in leaders' approach towards technology in healthcare over the last couple of years?
Okay. In the last couple of years, there's a lot of digital presences came into picture after the COVID came in. So digital communication and telepresence, in simple terms, the category includes any smartphone or internet connected computers. This came into a lot of effective communication mode for the patient with the doctors. Telephone, telehealth, telemedicine, telehospitals. These are the buzzwords came out after the COVID came in. It is not that this technology was not present before, but it was the real action came in only after the COVID came in. The digital technologies have aided the transition from paper-based electronic health records and allowed for a richer, more data-dependent base of leveraging interconnect of health records. That's what happened during the COVID time. Then there are some changes coming in. Semi-autonomous service robots are came in picture, where the patients are COVID positive patients, where doctors don't need to directly interact with the patients. There are a lot of teleconsultation done through service robots. There are medicine got delivered through service robots. This is the second thing. Third thing is artificial intelligence came in a big way. A lot of algorithms came into effect during the COVID period. Rather than following a predetermined or detailed direction provided by the programmers, one particular form of AI machine learning allows technology to develop its own rules and response once trained in existing areas. So artificial intelligence played a big role during the COVID period. These are the three major changes happened in last couple of years.
So that's about the technology changes that you are seeing. What about the healthcare models and healthcare practices? So what are the changes in healthcare models and practices you have observed during the pandemic?
See, COVID-19 pandemic acts as a transformation catalyst, actually, accelerating the implementation and adoption of changes in public health intervention. Thus, a new model of healthcare delivery emerges with more emphasis on preventive measures, remote care, and substantially technology dependencies. There is a study done by one of the agencies. They found that consumers' concerns around health management was afraid of visiting a hospital around 62%. Frequency of hospital visits once lockdown and pre-lockdown and post-lockdown, it is came down to 74%. Willingness to undergo elective procedures came down to 28%. Delay by more than 6 months till the vaccine comes out, 54% delay for 1 to 6 months for their procedures. Doctors' consultations of 44% consumers have used telemedicine either during or pre-lockdown period. 58% change in usage of lockdown, 73% increase in willingness to use telemedicine. Previously, this telemedicine was there before also, but it was never ever used like this, the way it has happened during the COVID time. Then the third thing is the 74% increase in home collection of samples for visiting the hospitals or labs. Patients opted to get a sample collection done from home than visiting a hospital or lab. The next one is telemedicine. The people started purchasing the telemedicine subscriptions. Around 54% people done it. Home healthcare, they purchased around 49%. Home sample collection increased to 42%. Home delivery of drugs and chronic disease medicines increased around 36%. This is the major change happened during this period.
So still we see that India is among the countries with the lowest number of beds per 1,000 people. Okay, the pandemic has only highlighted the gaps that we have in the healthcare delivery. Okay, so how do you think that hospitals are helping address these gaps with the help of technology? How exactly are they using technology to bridge the gap between the means as far as delivery and availability of beds per thousand patients, or availability of good doctors per patient?
With a population of 1.3 billion scattered across urban and rural India, the country poses a unique healthcare challenge. According to a report by United Nations, 75% of the all healthcare infrastructure, including medical specialists and doctors, concentrated in urban areas, where 27% of the Indian population live there. Added to this, the fact that private hospitals and quality healthcare are limited to urban areas. Meanwhile, around 716 million people, that makes up the remaining 72% of the population, stay in rural areas with chronic lack of primary healthcare facilities. One of the most pressing challenges for India to offer world-class care at affordable rate to all the citizens. That's one of the major challenges.
Yeah.
According to Indian Brand Equity Foundation, the Indian healthcare industry will grow from $160 billion in 2017. It's going to increase to 280 billion by 2020. So that was the prediction done. Technology will clearly be the backbone for this growth story. Adoption of electronic medical records is a key to improve care, reduce errors, bringing about cost efficiencies by streamlining the clinical care processes to improve the outcomes. Needless to say, the data gathered through EMR over a period of time can help in future refining the analytics model to improve the clinical outcomes. With increasing the awareness of health and wellness issues, patients will soon start playing a major role in the overall process of care. Already, consumerism of healthcare is driving many of the new age apps dealing in prevention and continuous monitoring of health.
Yeah.
Artificial intelligence enabled recommendation engines are helping consumers to make the choices that are never knew they could make. A high degree of personalization and care has been made possible through the use of technology. This is need of the hour. Since chronic diseases are in the rise, as is the demand for personalized care depending on the illness and psychological make of the patient.
Yeah. Okay. So, what we see that everybody is talking about building a resilient kind of model. Okay, building a future-proof, future-ready hospital. Okay. So, according to you, what are the costs, what are the risks, and what are the rewards that are involved in building a future-ready hospital? And how is technology going to strengthen that path?
The digital hospital of the future can leverage technology that transform care delivery, patient experience, and staff management, operation management, and a hospital design. The digital hospital of the future includes an air traffic kind of a setup where you are continuously able to monitor the patients and integrate data like the way when a flight come to an airport. That is the kind of monitoring system we will be able to adopt in the future.
Very good.
Personal and portable care, an era of new technology advancements, including 3D printing, robotics, nanotechnology, genetic coding, and the therapeutic options can permit more personalized and accessible patient care. Many devices and equipments are getting smaller or more portable, and the treatment will likely become more targeted, all of which can make future healthcare more mobile and precise. In the near future, digital technology may improve the patient experience by providing real-time access to medical knowledge. Imagine an AI-powered bedside virtual care assistant for an important patient that can answer for direct access to the most appropriate person at the hospital. But the thing is that the technology comes at a cost. All these latest technologies are going to be I don't think at this moment it is an economical solution, but future when the volume increases, the cost may come down. Otherwise, all this kind of technologies are expensive at the moment.
Exactly. Exactly. So, can you also please talk about your recent initiatives, means in terms of technology adoption, and how exactly are you planning to make Jehangir Hospital a kind of future-ready and resilient one?
Establishing open collaboration with universities, research institutes, and innovative technology companies to embolden the staff to develop new approaches that improves care quality. Set up similar collaboration with government agencies, opinion leaders, and industry unions to encourage the staff to think about healthcare delivery in a broader terms. Make significant investments in hospital staff to deepen their knowledge for what smart hospital is and smart ecosystem is can do, and to build the capabilities needed to ensure that the best outcome are achieved. The best results are often achieved when as much attention is paid to change management as to change themselves. Addressing the mindset and cultural of both the clinical and non-clinical staff is crucial in this.
Very good. So, can you also talk about your top focus areas, top technology priorities over the next couple of years?
Okay. From Jehangir perspective, we have implemented a picture archiving system for the imaging department where the radiology images, once the patient took an image of X-ray or MRI or CT scan, the consultant can see it in their clinic immediately, not like they need to wait for an X-ray image to be printed. That's one thing. Second thing is we done implemented a software called SafeTrans application. It's a vein to vein blood transfusion traceability software. If a patient needs a blood transfusion, the moment the donor registers in the hospital till the blood get transfused to the patient, then their transactions are monitored in the system, and there's a board system, blood order and transfusion safety system we implemented it, which reduces the human errors and human errors basically mismatch of patient data or blood grouping. All that is avoided this. And to support the doctors, we have implemented a document record management system where all the patients' past records are scanned and stored into the servers, which is doctors will have access as per the specialty. Then we implemented something called portal management system. We call it as Uber of healthcare. Portal management system is basically we implemented a solution for when nurse need to shift a patient from ward to an MRI or a CT scan. She will be able to log into the system. She will put a request. The nearest transport staff available in the hospital will receive the request. He will accept it exactly like the way we request for a Uber taxi. So once the transporter accepted the request, till the time he completes the transfer to the end the location, everything is monitored with the timeline. There are dashboards are available. So pre-implementing this solution, we used to have around 5,000 patient shifting in a month, where we could able to achieve the same period for 12,000 shifting in a month. It's one of the biggest achievement we could able to get it. The next one is a QR code based consult system. The patient is admitted in the hospital. Each and every room will have a QR code. Patient can scan the QR code. All the related services like engineering, then nursing, housekeeping, F&B, food and beverage services, all will be listed there. They can choose the service that they wanted. We call it a Swiggy of healthcare again. And when the request is raised, then till that time the request is completed, the complete transaction is monitored through various tracking solutions. One more application which we implemented in this pain management system. If a patient get admitted, if patient feels some pain, then they can scan a QR code, they can raise a request. The request directly goes to the nurse based on the pain scale. Those different pain scales are there. If it is severe pain, then the request goes to the consultant doctor who treat the patient as well as nursing supervisor also. And we have dedicated pain nurse available in the hospital. So she will attend the patient immediately and take the necessary treatment to reduce the pain.
So, can you also brief us about your top focus areas over the next couple of years?
Okay. Now, the next couple of years, our major focus areas are: one is clinical management system. We want to have an end-to-end clinical management system from the time patient registers till the time patient is alive. The complete life cycle of patient in the hospital will be tracked with the various dashboards and AI kind of a solution. And second one is we are also in the process of trying to find out some robotics where we can implement in the operation theaters and other areas.
Very good. Thanks a lot, sir. Thanks a lot for your valuable inputs. Thanks a lot for your time. It's indeed a
Thank
very
you, Mr. Amit. It's a pleasure to interact with you.
sure, sir. Sure.
Thank you.
Thank you. Have a good day.
For more updates from CXO TV, please like and subscribe to our channel.